excited to start my healthy habit of exercise and diet, and I hope it will last for a lifetime.
Ready now, baby, here I come. I'm beating fast like a jungle drum. Once you go, you just can't stop. I go all the way straight to the top.
This activity is brought to you by the Center for Preventive Health and Lifestyle Medicine. Today we go out as a TMC community. Patients and different medical professionals not just move, but even dance, eat, and learn together as one.
Ready or not, here I go. Feel my power, power. I'll take you higher, higher. Feel the power, yeah. Ready or not, here I come. I was born to be on the run. Shine forever wild and young. Bright as gold, eclipse the sun.
This center has been there since 2009, but we're now being more active in promoting health and wellness through these kinds of activity in celebration of the World Wellness Weekend also.
Ready or not, here I come. Feel my power, power. I'll take you higher, higher. Feel the power, yeah. Power, power. Can you feel the power, power? I'm gonna take you higher, higher. Can you feel the power, power?
In TMC Wellness, health is an acronym for habits to engage and achieve lifetime health. Remember that it takes 21 days to build a habit and 90 days to create a lifestyle. So expect more of events such as this because we are definitely your partners in health.
Feel my power, power.
We would like to invite you to other activities of the center in the future. Thank you.
Feel my power, power. I'll take you higher, higher. Feel the power, yeah.
Okay, good afternoon, everyone. Can everyone hear me clear? And can you see the slides being shared?
Good afternoon.
Hi, good afternoon. Okay, so magandang hapon po sa inyo lahat. We'll be starting now. And I'm happy that you're all able to make it despite being a working weekday. This is a special webinar series that we made for the benefit of everyone given our present health predicament. For those who have not met me yet during your checkup here with us, I'm Dr. Flores, and I'm the current director of the Wellness and Aesthetics Institute of the Medical City. So I'd like to formally welcome all of you to your lunch date with your Wellness MD. It's a webinar series entitled Make Time for Your Health. Health is an acronym for habits to engage and achieve lifetime health. This is a 7-part series which will be aired live during lunchtime like today, starting today, June 23, Tuesday, up to next week, July 1, Wednesday, and I do hope you complete the whole series. So this is officially our second major event under the slogan, Make Time for Your Health, which started last year around September when we celebrated World Wellness Weekend. I'm not sure if you're able to catch a video clip of this one while waiting, but it was a fun activity that was enjoyed by people of all ages. And surprisingly, the most active ones in Zumba are the elderlies. Ang gagaling gumalaw. So we have a movement session back then with Zumba, followed by a relaxation session with yoga and meditation. And the last one, while they were all resting, was a cooking class. And we hope to do this again this year after our webinar series. So this year's health series will impart knowledge, insights, and information regarding your health and how COVID-19 has influenced it, how COVID-19 influenced the already existing global burden of disease, which we call non-communicable diseases. Ito po yung mga sakit sa puso, diabetes, sakit sa baga, dala ng sigarilyo. And then how we can help maintain and even optimize your health during this trying time. So today's webinar is a prelude to the others in the series. So for today, I will be briefly giving an introduction about COVID-19 and the previous pandemics that we experienced, at least in the past century. Then I'll move on to show the different factors that may predispose a person to a more severe COVID-19 infection. Then move on to discuss the epidemic of chronic disease. Then briefly give an overview on health strategies and how we can try to overcome these challenges. Hold on. So the disease that is COVID-19, actually coronavirus has been with us for a while already. This is not a new virus, but the strain is different, so it's relatively new. But coronavirus has been with us for a long time, and 15% of common colds are caused by coronaviruses, but the majority is actually caused by the rhinovirus. Okay. So, but there were two types of this coronavirus, that a set of outbreaks of deadlier diseases. I'm sure you're all aware of the SARS-CoV that hit Hong Kong, China, and MERS-CoV that hit the Middle East. But their impact has been contained and mild compared to the effect of the new kid on the block, the SARS-CoV-2. So, and for small invisible spiky ball, it seems a lot bigger, as big as the Earth actually, because in just a few months, it has caused a temporary stop to everything we consider significant, which is mainly socializing. And as humans, we need to socialize and to connect to other people, and we normally do it in person. Ito yung mga close contact greetings, handshakes, beso, hugging, meetings, parties, church services, malling, dining with family, and competitive sports. All of these, COVID-19 has put a temporary stop to all that now, since COVID-19 can spread through all these channels. Early 2020, we did not know much of this virus, but the world has erred on the safe side. Mabuti na raw sigurado. And it resulted to multiple lockdowns and quarantines in several nations globally, potentially putting the world in economic recession. The worst of them all, being thousands and thousands of lives. So a little, a brief snapshot of the previous pandemics that hit the last century. The 1918 flu pandemic spread really rapidly, killing 25 million people in just the first 6 months. So compared to COVID, right now we're at 8.7 million after 6 months. So talagang matindi yung unang flu pandemic back in 1918. But during that time, much of the high death rate can be attributed to crowding in military camps. It's the time of war. And as well, crowding, and as well as poor nutrition and sanitation. And it's now thought that many of the deaths back then were due to development of secondary pneumonia in the lungs that were already weakened by the influenza. So in the late 2002, you can see here, and I'll just show you with a pointer. Late 2002, an emerging pathogen spilled over from the animal world. As shown kanina, no, there are different vectors of coronaviruses, and normally these are animals. So it started to cause a type of severe respiratory illness in China. So through the first half of 2003, the severe acute respiratory syndrome, coronavirus or SARS-CoV, spread to 26 countries, infecting at least 8,000 people and killing at least 10% of that. So another respiratory illness caused by coronavirus is called the Middle East Respiratory Syndrome, or MERS, and has an even higher case fatality rate of 35% compared to SARS-CoV, the first one. SARS and MERS didn't cause the same level of devastation that COVID-19 has, largely because they aren't as easily transmitted. And rather than moving by casual person-to-person transmission, SARS and MERS spread from much closer contact between family members, healthcare workers, and patients. In the case of MERS, it's a direct transmission from camels to people. These viruses, a very important point, these viruses also are not spread through pre-symptomatic transmission. It means that infected people don't spread it before they have symptoms, unlike what we're having now with SARS-CoV-2. Once people get sick, they typically stay home or were hospitalized, making it harder for them to spread the virus around. So that's the characteristics of the SARS-CoV and MERS-CoV. Now, going back 3 years from MERS, 2009, a new version of the original influenza virus emerged and began to spread very rapidly. Since it's related to the initial flu virus, it has a potential for very rapid spread. Case fatality, however, is actually low, 0.2 to 0.4%. So that's the reason why actually swine flu for the H1N1 did not overwhelm our healthcare system that time. And it wasn't really considered a very serious pandemic. Now, as of 2 days ago, SARS-CoV-2, the one that we're facing right now, has a total number of cases of 8.7 million. Up to the case fatality rate is 5.3% globally. Okay. So another thing I want to point out, of all the pandemics, the ones commonly affected are the older adults and the ones with underlying chronic conditions. So this is just an update of of our local data. As of now, as of 2 days ago, total cases in the Philippines, 30,000, and total deaths around 1,100, with a case fatality of 3.8%, much lower than the global mortality rate. Who are the vulnerable ones? This is a very important question that we will answer today. And who are these individuals and what are their characteristic features? Okay, we will take a look at several large systemic reviews and meta-analysis from 3 areas that were largely hit by COVID-19. We have China, US, particularly New York, and Italy. So this is the study coming from China. It's a conglomeration of 7 big studies with laboratory confirmed COVID-19. All cases were from hospitals in China, with a total number of around 1,500, spanning from mid-December of last year to early February. And the findings during that review is that the prevalence of chronic diseases, such as hypertension, type 2 diabetes, cardiovascular disease, and chronic lung disease, as seen in that review, are risk factors for severe disease from COVID. Looking at New York data naman, in the US, particularly New York, out of 5,500 deaths from COVID-19 as of early April, 86% of those have at least one comorbid condition. And the most common is hypertension, then followed by blood sugar problems, blood cholesterol problems, heart disease, and so forth. The same pattern actually can be seen in those patients who died with COVID in Italy as of May 2020. And again, you see the same pattern, no? They have hypertension as the number one comorbid, the most common comorbid, type 2 diabetes, heart disease, kidney disease, and lung disease. And in addition to what I have shown you, there are several studies now that have identified that having a problem with weight or being overweight or obese is an independent risk factor for COVID-19 and its complications. This means that despite age and the presence of comorbid conditions mentioned earlier, being obese can further predispose you to a rough clinical condition. If you're young, you don't have comorbids, but you are obese, then you're in the same hotspot. So studies from different countries, China, US, and Italy, have shown that obesity increases the likelihood that you'll end up in a hospital due to complications of COVID, such as pneumonia, or end up in an ICU because you have to be hooked to a mechanical ventilator, and that your disease course can be more severe. So I'll be explaining to you two factors why obesity can actually cause this issue with COVID-19. People with, this is a picture that shows the mechanics of how we breathe. When we breathe in, our chest wall, that includes your muscles, your rib cage, your lungs, they expand. And this part here, below the lungs, is what we call the diaphragm. When you breathe in, your diaphragm goes down towards your abdomen. Okay. So when you breathe out naman, the opposite happens. People with substantial obesity are carrying a lot of weight, mostly in their abdominal area, below the diaphragm. So when we move our diaphragm, so you normally move your diaphragm towards your abdomen every time you breathe in, especially when you're inhaling very deep. So if you have extra weight in that area, the diaphragm's movement becomes restricted. Actually, this would be true for any respiratory disease. Now, in addition to that, if someone gets COVID-19 and pneumonia from COVID-19, the structures and networks within your lungs, like your blood vessels, become leaky due to inflammation, and this allows fluid to enter the airways, your lungs. And this makes it hard to get oxygen from the air to the blood. Now your body will compensate. The effort and depth of breathing will become more intense as a compensatory mechanism. This will actually put more pressure to the diaphragm. It will make the diaphragm work even more. And obesity severely restricts this compensatory response. If this is not addressed, actually, a lot of individuals, that's the reason why a lot of obese individuals with COVID has a tougher time breathing than someone who's not obese but with COVID. Okay, another reason is what we call inflammation. When you're overweight or obese, you have a lot of fat tissue. Actually, the most basic component is what we call adipose, or the fat cell. Fat itself is metabolically active, and it produces a fair number of molecules that causes some form of low-grade inflammation in the body. So it's as if your body is kind of battling itself continuously, a little war caused by signals released from these fat cells, which your immune system reacts to, producing this low-level type of inflammation in the background. So looking at this diagram, in a normally weighed individual, this is the normal baseline immune response up to this level. Comparing it with someone with who's obese, the immune response is a little bit heightened. Now the arrows represent infection with infection of any cause, be it COVID or any other pathogen. So the one who's not obese would have a normal immune response. The one who has an extra weight will have a hyperactive immune response, and this can actually explain why patients tend to have a more rough clinical course if they're obese. And if you're obese also, it can lead to other problems, diabetes, heart disease, and cancer that can perpetuate this cycle. And so based on the studies shown, having comorbid conditions such as heart disease, hypertension, cholesterol problems, blood sugar problems, chronic lung disease, being overweight and obese are all found to increase your risk or a person's risk for a severe clinical course from COVID-19. And these same chronic disease conditions, including their underlying drivers like weight and being sedentary, that may actually lead to an infection and its complications, are known also as non-communicable diseases, which have been by itself an epidemic since the beginning of the Industrial Revolution. So this is roughly data since 2019 comparing the leading causes of death roughly around 3 decades ago, comparing it to 2017. What used to be the top killers 3 decades or so ago, the communicable or infectious diseases, 1, 2, and 3, have taken a backseat to give way to these NCDs such as heart disease, heart attacks, strokes, and lung disease. As you can see there, nag-level up sila. Nag-increase yung number of cases leading to death. Now, in the Philippines, these NCDs are responsible for the deaths in the elderly, which is a given, but disturbingly also affect the younger age group, including the working age population. On the average, NCDs, 59% of NCD deaths are premature or occurring earlier than age 70. The gray ones are actually the deaths from NCDs from patients who are older than 70 years old. And the black ones are the deaths from NCDs younger than 70 years old. So, and compared to our ASEAN neighbors, the Philippines unfortunately ranks 1 in this category. So this diagram illustrates the causal relationship of several factors in the ultimate expression of the disease states of NCDs. These are not conditions that just pop up out of nowhere. There are normally underlying causes. So the immediate drivers for chronic disease are determined by certain metabolic indicators, as I mentioned earlier, the weight, blood pressure, sugar, and cholesterol, which are driven by behavioral factors such as the use of tobacco, the abuse of alcohol, having a consistently unhealthy diet, and being consistently inactive, which is stemmed from more social determinants, like globalization, urbanization, aging, social culture, corporate behavior. So this diagram shows you the trends in the prevalence of metabolic risk factors, meaning the weight, cholesterol, BP, and sugar in the Philippines from 1992 to 2013. As you can see, there is a slow increase in prevalence of blood sugar problems. Same goes for having high cholesterol. Same goes for having high blood pressure. And a steeper slope for having problems with weight. With the weight issue, this is for adults now on the left side. The right side, we're seeing an emerging issue with weight problems among the young, the children. So among 0 to 5 years old, there is an increasing trend of weight problems, particularly being overweight and obese, and also with the 10 to 19 years old. So this table shows naman the prevalence of, well, the same thing, metabolic risk factors, but by sex and location naman. To date, every 1 out of 5 Filipinos are hypertensive. Every 1 out of 20 Filipinos are diabetic. And for every 3 of 10 Filipinos are overweight and obese. This one shows the prevalence of the behavioral risk factors. A quarter of Filipinos are currently smoking. at least for that time frame, no, that it was collected, the data were collected. And then 1 out of 4 Filipinos are alcoholics, and roughly around more than 2/3 of Filipinos have insufficient physical activity. Okay, in this table, it shows the interconnecting matrix-like relationship of these risk factors and with their chronic diseases counterparts. To put it simply now, if you switch off one risk factor, you switch off or you lower the risk for all 4 chronic disease, and vice versa. Turn one on, turn two on, the risk actually is cumulative. So what do we do? The World Health Assembly, recognizing the need to address this epidemic that's related to lifestyle, has identified a threefold strategy. Okay, one is prevention through actions on common modifiable risk factors that I mentioned earlier: tobacco use, alcohol use, diet, and movement. Next would be management of already existing chronic diseases and the immediate underlying metabolic conditions such as BP and cholesterol, utilizing cost-effective interventions. And lastly, surveillance. So achieving this balance between the use of lifestyle and medications is the ultimate goal and is actually considered a big part of medicine, but it's a little tricky, and I'll show you why. There is a glaring tendency to focus on the upper part of the chronic disease pyramid, the after effect of what we call downstream effect. There's been, well, looking at this caricature, you see here that there's been too much focus on mopping the flooded floor instead of turning off the faucet that's actually causing it. There are too many pills to control the metabolic indicators and less effort in modifying behavioral risk factors. So as seen here, based on a Policy Center report in the US entitled "Lots to Lose: How America's Health and Obesity Crisis Threatens Our Economic Future," suggests that not spending money now on fitness, on healthy behaviors, fitness, on healthy food, means we will eventually spend money on medical services, hospitalization, drugs, and surgery. Either way requires money from our pockets, but in the first scenario, we become healthier as we spend it. Pills may control the numbers that we see on our blood tests, but it can never replace our nutrient-lacking but calorie-dense fast food. It can never enhance our heart and lungs as exercise does, nor can it increase our mental sharpness. Health is not just the absence of disease, but is a dynamic state of optimal functioning of our bodies in order for us to be able to do exemplary work. So I'm just going to throw this in. My personal patients have seen this already in my clinic here in the medical city. Now, this diagram illustrates that health is a continuum from severe sickness here that leads to premature death here on the left side, to optimal health here on the right side that leads to enhanced quality of life. So individuals who are known to have sickness already with symptoms, positive test results, complications of disease are on the left side of the continuum. Those who with no overt disease, but with risk factors, for those who do not know yet their state of health, are in the middle. And those who are actively practicing healthy habits and lifestyle are on the right side. Like what I tell to my patients, it doesn't matter where you are. What matters is the direction that you are facing. A person with a disease condition but tries to consistently adapt to a healthy lifestyle may eventually move from right to left, from sick to well. And likewise, a healthy, fit young individual who let go of his healthy lifestyle for whatever reason may eventually move from right to left, from well to sick. The important point here is being aware in our position in the continuum, wherever that may be, and knowing what to do to move ourselves within it, ideally towards the right. This is empowerment, and this is taking control of our health. If you do not know where you are in this continuum, and if you don't know what to do to move yourself within it towards the right or being well, then let a medical professional help you with this. So we need to refocus our efforts in bringing a balance to the scale of medical management. There is a time and place for pills and surgeries, and a time and place for lifestyle behavioral risk management. And oftentimes there will be overlap, but treating the root cause of disease first would have a much better outcome for chronic disease management in the long run. This is just a sample framework that we do in practice. So the annual medical evaluation is normally the first step in order to screen and evaluate individuals for present illness and identify potential underlying risk factors. Next is we use the data gathered to help our patient clients reflect and create their own health goals, be it nutrition, weight, movement, sleep, stress, or addiction control. And we deliver this through either a one-on-one consultation format, the advantage of which is that there can be, since it's private, there can be openness to share sensitive information, or through a support group setup. The advantages of which is the ease of mobilizing motivation and support coming from other people with the same health goals. So change towards becoming healthy is a journey. We try to accompany our patients in their journey. We walk beside them as a partner, not in front of them as a dictator. This creates a more stable relationship in helping them achieve their health goals with the physician as their partners. So it's easy to dismiss things that we don't see, like a virus or like a problem with a BP. And most of us are oblivious to the signals that our bodies are telling us when we are mindlessly using it. Now, COVID-19 has brought into our consciousness the importance of health. And now more than ever, we have become fearful of sickness and we worry about our health. In the era of chronic disease epidemics and infectious pandemics, becoming healthy is one of the things that can protect us. By combining the strategies that prevent the overt spread of COVID-19 or infection for that matter, and fortifying our bodies to make it strong and resilient, then we have a formula, a robust defense against the chronic pandemic and the long-standing chronic disease epidemic that we are facing. So I think I'm up to my last slide. Key points before I end. Number one, COVID-19, although scary, since we don't have any solid proven medications yet or even a vaccine, is still something that we can beat. Risk factors that predispose a person to succumb to COVID-19 are the same risk factors that's causing the current global burden of disease. Knowing your state of health is important. Do not wait for symptoms to come. It might be too late. Knowing is half the battle. And lastly, your outlook towards health is important, and your physician can be your partner in this endeavor. So with that, I end my presentation. Let us fight this combination of pandemic and epidemic together. Okay, thank you very much for listening. If you have inquiries, questions about the topic or inquiries about our services, please contact us via following details.